Our next story is a follow-up to yesterday's story about these maps released by the mayor's office. They show the number of positive coronavirus cases by neighborhood. Now, y'all, when I posted these to my Twitter page yesterday, people immediately started commenting and asking questions. Some of the more popular questions were summarized by Kirsten Holmes. She asked, are those areas Black and brown communities? Do they have higher essential worker populations? And why are so many Black and brown people essential and unprotected? To get answers to some of those questions and more, I spoke to Ward 1 Councilmember Brianne Nadeau. Her ward had the second highest number of positive coronavirus cases in the district. Question 1, are those areas Black and brown communities?
We know that Columbia Heights is probably the most diverse place in the city. There's a mix of different backgrounds. One of the things that they think is the leading cause of this is the household size in Columbia Heights. Now, there is correlation to that, to other poverty measures, and it could be also a racial or ethnic background.
Question 2, do they have higher essential worker populations?
The other theory that the Department of Health has is actually we have a lot of essential workers in that area. People working in food service, people working in hospitals, people working in transportation. Also perhaps the correlation to race or income.
Question 3, will people who are Spanish language dominant receive care in Spanish while quarantined in the government healthcare housing?
We're not only required by law to provide culturally competent and language-based healthcare and services as the government, we believe it's the right thing to do. A lot of the medical care that we have is through our community partners. Unity Healthcare is one of our biggest partners for these types of programs, and they certainly have a lot of bilingual staff. Of course, their huge clinic is right there in Columbia Heights.
Nadeau says that these are local programs that are providing these services. She also added that healthcare is available for undocumented immigrants. To learn more about those programs and how to apply, you can visit the Department of Human Services website. I'm posting a link to that to my Twitter page right in the commercial break.